Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So, let's take a look.
Hi everyone. Today we're going to talk about an important topic for our health: veins. If you suffer from varicose veins, hemorrhoids, or circulation problems, pay attention. I am going to introduce you to a medication called Daflon that can be of great help. So what is Daflon? It is a medicine that improves vein health. It helps veins to be stronger and more resistant, which makes it easier for blood to flow properly through them. When is Daflon used? Doctors prescribe it when there is chronic venous insufficiency, which is when the veins have problems returning blood to the heart. It is also very useful for treating hemorrhoid flare-ups because it reduces pain and inflammation. And how does it do all of this? Daflon contains two substances called diosmin and hesperidin, which belong to the flavonoid family. These substances act on the walls of the veins, making them stronger and improving blood circulation in the small blood vessels. It's like a workout for your veins. Let's talk about how to take it. It is normal to start with 2 pills a day, one in the morning and one at night. Afterward, to maintain good vein health, 1 pill a day is usually enough. Of course, it is always important to follow the instructions given by your doctor. Can it have side effects? In some cases, Daflon can cause stomach discomfort, headaches, or dizziness. If this happens to you, do not hesitate to contact your doctor immediately. And remember, do not take Daflon if you are allergic to any of its ingredients. In short, Daflon is a good option to take care of your vein health and relieve the discomfort of hemorrhoids. But as always, the most important thing is to consult with your doctor before starting to take it and follow their recommendations to the letter. Take care of your body and see you soon in the next video. See you next time.
If you've made it this far, let us know in the comments why you're using this medicine.